Good afternoon, ladies and gentlemen. It's my great honor to chair this session, presidential lecture. And thank you for keeping internet connection to attend this virtual conference in spite of weekend Saturday afternoon. It's my great pleasure to introduce the speaker. President Chung of Korean Gastric Cancer Association graduated from Kyungpook National University 1985. And he received the PhD degree from Kyungpook National University Graduate School 1995. And he finished surgical training course from 1988 to 1999. Kyungpook National University Hospital. He studied overseas as a visiting professor at Georgetown University Medical Center, and he was designated as professor of surgery in 1998, and they also appointed as professor of medical informatics 2004. In addition to his clinical and scientific activity, he had been serving for hospital management. His hospital manager career started as Chief Communication Officer at Kyungpook National University Hospital. And also he worked as President and CEO at Kyungpook National University Hospital from 2017 to 2020. Let's invite President Chung. Would you please speak?
Thank you. Kind introduction, Professor Min, former president. And it's my great honor to give the presidential lecture here today. And my presentation file, please. Hello, I am Ho Young-jung, president of the Korean Gastric Cancer Association. It's my great honor to speak the presidential lecture of KINCA Week 2021. Today, I will first talk about my past challenges and choices, and then I will talk about our challenges of the present and the choices for the future. Nowadays, we must deal with COVID-19 in every areas. Our time has been divided into the new BC, before COVID-19, and AD, after disease. Those good days before COVID-19. When I was in high school, I was interested in both electronic engineering and medicine. And I had to choose one path. Eventually, I chose to study the medicine and entered Kyungpook National University Medical School. Even when I was a medical student, my love for the electronic engineering never faded away. In my spare time, I made medical insurance billing programs for the local clinics with an 8-bit Apple computer. After graduating from the medical school, I worked as an intern at the Kyungpook National University Hospital and considered choosing between surgical and non-surgical fields. I chose the surgery and I did my residency at the same hospital. When I was a surgical resident, I programmed the so-called electronic medical record, EMR, with an Intel 8-bit PC and used it in my department of surgery. Since I became a specialist surgeon, I have performed many kinds of surgeries in the general hospital. And in 1998, I started the faculty of surgery at my alma mater, Kyungpook National University Medical School. Since then, I have been doing mostly gastric cancer surgery. In 1999, we performed hypothermic intraoperative intraperitoneal chemotherapy for the advanced gastric cancer patient with Professor Wanxing Yu from our Kyungpook National University Hospital and Dr. Paul H. Sugarbaker from the Washington Hospital Center. I also introduced gastroduodenostomy using a circular stapler during distal subtotal gastrectomy at the IGCC 1999. And since then, many surgeons have preferred the stapled anastomosis for the Billoth type 1 surgeries. Around the same period, I published a study suggesting that routine gastrointestinal decompression is not necessary after gastrectomy. Since then, we have eliminated the routine use of the nasogastric tube in the gastrectomy. For decades of years, my team has kept interest in the gastric cancer patients' quality of life after surgery. For 2 years from 2002, I studied the medical informatics at the Georgetown University in the United States. During those days, my research project was mainly about the operating room of the future, named OR 2020. But I also studied telemedicine, robotics, and internet surveillance of the epidemic disease outbreaks. At the OR 2020 workshop in Maryland, including the Georgetown staffs, many people from the National Institute of Health, Johns Hopkins, US Army, Pentagon, and World Reed Hospital had participated. After returning from the United States in 2004, I was also a professor of medical informatics. In 2019, I became the president of the Korean Medical Informatics Society and held the COSME 2019 conference at Kyungpook National University. Last year, in 2020, we faced a terrible disaster called the COVID-19. And this new challenge asked me for many hard choices. For your information, I was the president of Kyungpook National University Hospital at the time and had been involved in the hospital administration and management for 15 years. On February 18th, several infected people began to appear in large religious groups in Daegu. And the infection spread to nursing hospitals with elderly patients. On February 23rd, there were too many people who needed quarantine check. To handle the situation, we built drive-through COVID-19 screening center at the Kyungpook National University Chilgok Hospital for the first time in the world. This world's first attempt was published in the Journal of Korean Medical Science. I think it was a great choice against the big challenge. In just a week, the quarantine beds of intensive care unit was fully occupied. So we urgently built more quarantine intensive care units in the hospital. Many elective surgeries had to be postponed because of the emergent surgeries for the infected patients. And some of the patients who were not infected postponed their scheduled surgeries in the fear of infection. Just a week after the first case, the total number of infected exceeded 1,000. And 3 weeks later, the total number exceeded 5,000. With a huge number of the COVID-19 patients, the entire medical function in Daegu City was almost shut down.
확진자들이 쏟아져 나온 대구시는 전체 인구가 250만 명에 이르는데 추가 전파를 막기 위해 주요 병원의 응급실들이 잇따라 폐쇄됐습니다. 가뜩이나 불안한 시민들은 아플 때 어디로 가야 하나 공포가 더 커지게 됐습니다. 코로나19 검사와
TV interviews
기관도 부족하다는
about the chain closure
문제는 김재노
of the
기자.
major hospital emergency centers due to exposure to COVID-19.
88개입니다. 하지만 코로나19 감염자의 경우 1인 1실을 원칙으로 하다 보니 실제 활용 가능한 병실은 65개에 불과합니다.
환자분이 타실 그 음악 카트가 필요합니다. 예를 들어서 이런 것 저희들은 보유는 하고 있지만은 이게 한 대 갖고 또 모자라기 때문에 그런 거에 대한 지원.
코로나19 무더기 확진 판정으로 대구의 상급 종합병원 5곳 가운데 이 4곳의 응급실이 폐쇄됐습니다. 이 병원마다 비상이 걸린 가운데 응급의료 체계가 무너지는 것 아니냐는 우려까지 커지고 있습니다. 박재영 기자가 취재했습니다.
코로나19 무더기 확진 사태가 응급실 연쇄 폐쇄로 이어지고 있습니다. 어제 오후 동산병원 응급실 폐쇄를 시작으로 경북대병원, 영남대의료원, 대구 가톨릭대병원 응급실까지 문 닫았습니다. 대구 상급 종합병원 응급실의 80%가 코로나에 뚫리면서 초비상입니다. 경북대병원은 코로나19 감염자와 접촉한 의료진 29명을 자가 격리했습니다. 다른 대형 병원도 사정은 비슷합니다.
응급실에 수십 명이 입원해 계십니다. 이 수십 명 입원해 계신 분들을 또 다 병실로 분산 수용을 해야 되는 이런 문제가 있습니다. 다들 잘 아시겠지만 저희 병원에 병실이 절대적으로 부족하지 않습니까?
앞서 전해드렸듯 환자가 급증한 대구에선 치료 병상도 의료진도 물자도 모두 부족한 상태입니다. 사명감으로 현장을 지키는 의료진들의 이야기를 박창근 기자가 들어봤습니다.
대구에선 코로나19 환자를 위한 음압병상은 물론 일반 격리병실도 부족한 상태입니다. 마스크, 방호복 등 물품의 재고량도 심각한 수준입니다.
저희들이 지금 현재 11분 정도의 음압격리 환자들이 보고 있습니다. 장비와 물품이 절대적으로 부족한 것도 맞습니다.
가장 부족한 건 환자를 돌볼 의료진입니다. 휴일도 없이 24시간 병원에 머물며 환자를 돌보지만 일손은 점점 빠듯해져 갑니다.
So, within a week after the first confirmed infection, the government training center was reformed into a residential treatment center for the first time in Korea and was managed by our medical staffs of Kyungpook National University Hospital. COVID-19 patients with asymptomatic and mild symptoms were moved there to be quarantined and treated. This residential treatment center successfully prevented the shutdown of the large volume hospitals in Daegu City by aparting minor COVID-19 patients from the hospitals. I think it was another great choice. You can see we are taking COVID-19 patients with asymptomatic and mild symptoms to the residential treatment center.
이번엔 중앙교육연수원에서 경증 환자들의 치료를 맡은 대구 현지 의료진을 한 분 연결을 하겠습니다. 경북대병원 정후영 원장 나와 계십니다. 안녕하십니까?
TV interview about the residential treatment center and the lack of protection gears.
일선에 계시면서 혹은 오늘 그 치료센터 입소하는 과정에서 가장 시급한 게 있다거나 혹시 좀 도움을 요청하실 만한 게 있습니까?
예, 저희들이 물론 이제 아시다시피 이 물품과 장비가 모두 부족합니다. 그렇지만은 사실 저희들에게 제일 필요한 것은 우리 국민 여러분들의 성원이고 응원이 되겠습니다. 저희들은 지금 현재 이게 새로운 낙동강 방어선을 저희들이 온몸으로 사수한다는 그런 각오로 최선을 다하고 있습니다. 제발 애정어린 그런 마음으로 지켜봐 주십시오.
네, 알겠습니다. 애써주시는 의료진들을 많은 분들이 응원을 하고 있으니까요. 힘내시기 바랍니다. 오늘 말씀 고맙습니다.
You can see our medical team listening to the instructions of the center. They rounded every room wearing level D protection gears. First group of patients were discharged in a week after getting 2 consecutive PCR negative results. This picture was taken at 2 p.m. in downtown Daegu. This lonely street used to be one of the most crowded streets in Daegu City. And it was just 4 days after the first COVID-19 patient. I think our drive-through COVID-19 screening center and residential treatment center were great choices against the outbreak of COVID-19. These people are some of our heroes, and their work is not done yet. Neither is mine. From now on, let me talk about our current challenges. Shortage of support staff is getting more serious. And technology is rapidly evolving. The standard of care will change constantly. And the amount of information will double every 4 years. So, it's very hard to stay current with specialty. To make matters worse, the pandemic disease hit us. The disaster of COVID-19 has made medicine a more important field. In the future, telemedicine will be an inevitable choice for mankind who have experienced the pandemic. Teleradiology, telepathology, telerehabilitation, telesurgery, teleconference, and so on will be more widely used. Many things will change from the contact to the untact, and many people won't go back to what they used to be. Medical robots will be a useful tool for doctors and nurses. It will be especially helpful in the treatment of severely infected patients. Current practice and training in clinical sites are limited and struggling to keep up with the rising demand of patients. Development of digital training using virtual reality or simulation of surgery might be a solution to this problem. Digital therapeutics, a kind of digital healthcare, are evidence-based therapeutic interventions driven by high-quality software programs. Many digital treatments are being developed for the prevention and management of a wide variety of diseases and conditions. Artificial intelligence could become a good friend for doctors, but we must be very careful and cautious when applying such a new technology to medical fields. Every time there was a great challenge in history, our humanity made a great choice. Now we will have to lead new lives in new ways, in new times. The journey of our lives will continue, and there will be new challenges that we have never experienced before. But we will find a way. We always have. Let's overcome new challenges with great choices. Thank you.
Thank you, President. We enjoyed, even though it's interrupted, in the way of talking. We enjoyed the very interesting story of your own work. Yeah. I'm so sorry, but customarily, especially in the presidential lecture, the chair does not request questions or comments from the floor or audience. So I'd like to close this session here. Thank you, President. And we all wish him to continue clinical and scientific and social activity anywhere he moves, and be happy and healthy with his family. And thank you all audience attendees and participants in the last session of KINCA 2021 in Seoul, and I hope you good luck. Thank you very much, your audience and the speaker, President Chung. Thank you very much.